Hey guys, this is Dan with Hope Point Myo. I wanted to do a video just on explaining the 4 points of myofunctional therapy and how that affects whole body health. It seems like they're very simple, but it's like, how can that affect whole body health? So the 4 goals when you do myofunctional therapy are lips sealed, tongue at the roof of the mouth, nasal breathing, and proper swallow or correct swallow. I'm just going to break them down one by one to explain how each one affects the whole body health. And what we try to do is you look at the symptoms. So if you imagine a tree, you've got the branches and the leaves, you look at all the different leaves and you follow them down, and that means things deeper are not correct. And so those 4 things are kind of like the root of the tree, and then they show up through all these different things or different symptoms that patients have, pointing to the roots not being correct. So we'll start with whenever the mouth is closed, or let's say we'll do the opposite. So we're working on lips being sealed, mouth closed. When they're not closed, and that means our mouth is open, and that our tongue generally is not at the roof of our mouth, it's down, low tongue posture. So those are kind of 2 in 1. The nasal breathing builds in there too. But when our mouth is open, just all the time, generally that means we're breathing through our mouth. But what that does is our tongue comes down low in our mouth, and it starts in infancy or early childhood. The thing that generally leads to that is there's some obstruction, allergies, nasal obstruction, and honestly even one professional says he feels like it can be a transition from being calm and relaxed to kind of a stress mode. He said, so if you have a child who has been at home whenever they are young, and then they transition to going to kindergarten or public school, then there's all of a sudden this change of being at school every day, all day, and their body is more stressed and more tense, so they're breathing faster and harder, and so they end up breathing through their mouths more. There can be all kinds of things that lead to that. There's a lot of science. Everybody's different, and that's why it's myofunctional therapy. We look at each individual because everybody's different. There's no cookie cutter, but we try to figure out what is the root of that. So mouth breathing, tongue's down. When the tongue's down, the tongue is actually, when it's in the roof of the mouth, it shapes the palate or the roof of our mouth. It shapes that. When it's down, there's nothing to shape it, so it tends to be very narrow. And when it's narrow, if you think of a horseshoe, if you have different teeth that need to fit in there, it's a lot more tighter and there's more crowding. Whereas if it's a more open horseshoe from that tongue being up there, then it's larger for the teeth to fit in. So we have this generation after generation of our mouths being smaller and our teeth don't all fit, so we have to get braces. But the other thing that we don't see that orthodontists should be looking into as well, not just straightening teeth, but there's a whole lot of structure above our palate and the roof of our mouth. That's what makes up our nasal cavity and all these different things. So whenever our tongue is down, our palates are narrow, the septum of our nose that separates the right side from the left side, if the palate is nice and flat and wide, that septum can be straight. But when the narrow palate gets narrow, that septum bends because there's no room for it. So then that tends to lead to deviated septums, which creates obstruction at our noses, and we're not able to breathe through them as well. They also get clogged a whole lot faster. And it also makes, if it's more narrow, everything's narrow, and the airway themselves, the nasal cavity itself, can be more narrow. So that's why we want to work on lips closed, well, tongue at the roof of the mouth. That's that one. And the other aspect of when we're breathing with our mouths open, it's not just that the tongue's down, but when we are breathing with our mouths open and we're breathing through our mouths, this is like 200% more air we're getting through our mouths than we're getting through our noses. So I tell people you use it or lose it, your nose, because when we're getting too much air, too much carbon dioxide oxygen exchange, our body can recognize that's not too much, or that is too much, and the body is always trying to stay in a state of balance, so homeostasis. So it's like too much air, so now we need to compensate somewhere over here to correct that. So it actually triggers your nose to get more congested to slow down the breathing, because this is what we're supposed to be breathing through. But the problem is we're breathing through our mouth. So when this gets more congested, then it makes us breathing through our nose even, or through our mouths even more. So it's just kind of a downward spiral. So in myofunctional therapy, the goal in breathing through not the mouth, but the nose, it's tricky, but there's transition time that we have to do. And we have all kinds of techniques that we teach our patients to use to start transitioning back into nasal breathing. So that whole step is reversed. The whole process is reversed. So instead of breathing through our mouths now, we're breathing through our noses. The other thing that does is when we're breathing through our mouths, we'll talk about the daytime right now. When we're breathing through our mouths through the day, we are built with our fight or flight system and then our rest and digest system. The fight or flight is the sympathetic. It's when danger's coming or something's there and our body's ready to run, ready to defend itself. Our parasympathetic is we're now resting, we're slow, things are digesting. That's when life is just calm and peaceful and our bodies are able just to relax. And we are meant to be in the parasympathetic mode a lot. The problem is when we're breathing through our mouths and we're getting all that oxygen and air exchange, we're kind of like in a chronic slow motion hyperventilation because we're just getting too much of the carbon dioxide oxygen exchange. And so our bodies are constantly in that sympathetic or that fight or flight mode. So then our bodies are always stressed. And it may be like if our body, let's say we sense danger, let's say our house is on fire and we need to get out, we kick in, our hearts start beating faster, we start breathing faster, and everything's engaged, it's ready to flee. That's our protective system. And that gets used, and that's what it's made for. But if we're constantly breathing like that and we don't have something to exert it through, then it's just there. That's all that buildup there, and it never gets released. So it's very unhealthy. That can lead to long-term health effects. I am convinced, this is me personally, I'm convinced that leads to autoimmune disorders because the whole body is just short-circuiting because it's always in the stress time. It never can relax. Now that leads into sleeping when we're breathing with our mouths open, just breathing with our mouths open. Then that we have like these certain numbers that leads to sleep apnea, different structures and things like that. So this plus this plus this have different factors, and we have enough factors. You have obstructive sleep apnea. And one of those factors is breathing with our mouths open. That increases our risk of sleep apnea quite a bit. So then if we have that, and not just sleep apnea, especially for women, they're not generally diagnosed with sleep apnea until they're older, but we have a sleep disordered breathing. A lot of us, actually, they say 1 out of 5 women have it. And again, I totally believe that because I see it in my patients every day and my dental hygiene patients when I'm screening everybody. But when we're breathing, struggling to breathe at night, or at least it's not quite right, then again, our bodies are in stress mode while we're sleeping because it's just trying to survive. It's trying to get that oxygen. So we're not getting into that rest and digest mode. That's when our bodies, when we're in our deepest sleep, that's when our bodies are actually, our cells are restoring and repairing, but we can't do that because our body's stressed. The other thing is when we're breathing through our mouths, we have sleep disordered breathing. Not only it's the breathing, but we are coming into a light sleep instead of that deep sleep because our body, especially women, our bodies are like, oh no, I'm not breathing well. So it keeps us out of that deep sleep. We stay in light sleep most of the night. And when you're in light sleep, that's not when the body does the healing and the restoring. So you're just not repairing, and it's still stressing. So we're living lives, if we have this open mouths, breathing poorly during the day and at night, we are living our lives in constant stress mode. And then when you add stress life on top of that, that just takes it to a whole new level. So from what I've seen, people who have these issues and then in of that have a stressful life, lots of kids are doing lots of stuff with their kids and their job stressful, all these things add up, they tend to have autoimmune disorders. That's what I've seen. I'm not diagnosing, I can't say for sure, but that's what I'm recognizing in patients. And so that's why we want to not be breathing through our mouths. We want to train ourselves to be breathing through our nose. It slows down. It gets us just the whole system. And I could talk about that for a long time, but breathing through our noses it when we breathe through our mouths, it bypasses many, many processes that we don't get through our mouths, but we get through our nose. One of them is when you breathe through your nose, you get nitric oxide, and nitric oxide is a natural vasodilator, so it helps your blood pressure. Just breathing through your nose helps your blood pressure because it opens those vessels just a little more because it's more relaxing. And it filters, breathing through your nose filters a huge amount of bacteria and viruses and allergens that don't get filtered when you breathe through your mouth. And so then your tonsils get swollen because you're breathing through your mouth because it's trying to filter what your nose was meant to filter. So then that causes an obstruction. It's kind of you see the downward spiral there. But it also just slows your breathing down, which balances your carbon dioxide and oxygen levels. When we're breathing through our mouths, it messes up those carbon dioxide, oxygen levels, and something called the Bohr method is whenever our body senses a certain amount of carbon dioxide, it won't release the oxygen into our tissues and our organs because it thinks it's got enough, and that happens when we're breathing through our mouths. But when it slows it down and it gets balanced, then it recognizes, oh, I need to release more oxygen to our tissues. So you actually get about approximately 14% less oxygen to your tissues and your organs when you're breathing through your mouth than when you're breathing through your nose. And you can wear like an oximeter and say, oh, well, my oxygen is usually about 98 to 100, which is really good. But it's not about how much oxygen is your hemoglobin, like being carried through your body. That can be perfectly fine. It's about it releasing it once it gets to the tissues, to the organs. And it's not being triggered to release because the carbon dioxide balance is off. So it all has to do with slowing the breathing down, breathing through your nose rather than breathing through your mouth. So that's a whole lot there covered. And we just talked about, the nasal breathing, the mouth closed, and the tongue at the roof of the mouth. But people, when you're, just keep going down the line, let's say you're living that life where you're not getting good sleep because you're breathing through your mouth and you have some kind of sleep disordered breathing and you're living stressed and you're tired, then that can lead to dealing with life when you're tired is unbelievably difficult. And I know this not so much from sleep disordered breathing, but from having little kids and babies. I had a daughter who was extremely, I would say, colicky. She was very gassy. An adult, I know now, had to do with the tongue tie, not being able to latch well. She was getting air in. And so my husband and I would take 3-hour shifts with her at night. And there were times he did work nights because he was a sleep tech. And so I had her all to myself. It was unbelievably hard. I just words can't even express it. But then trying to live life, trying to function on a day-to-day basis, trying to process things. And even just like when you have more than one kid and you're extremely tired and they're just coming at you, you can't handle it. It's just hard. And so for people, especially women, but I have seen this in men too, when you're living where you're striving to even be alive at night and then stressed during the day and your body is exhausted and your mind is exhausted, it really does impact mental health like crazy. And so it's just hard to deal with day-to-day life and reality when you are struggling from lack of sleep. And people don't recognize that connection there. They just think they have mental health issues, but a lot of times it can be rooted down to you just aren't sleeping well or you're not breathing well during the day and the night. So that's a big one. That also plays in, we're talking about children too, not just adults, but with children. They say some estimate 80 to 90% of children who are struggling with ADD or ADHD, the root problem is a sleep issue, is an airway issue at night. Way more children have this than you'd ever imagine. But when they're struggling at night to sleep and they're tossing and turning and they're not sleeping real deep. I mean, some people say, oh yeah, my kid sleeps like a rock. And it's like, well, you think they are, but they're not in that deep, deep sleep. They're still in that lighter sleep. And that's why they're tossing and turning because their bodies are trying to get air, or they're clenching and grinding, or they're maybe snoring. A lot of them will continue to wet the bed way later than being potty trained and things like that. Those all can be triggers, but they can be struggling with ADHD, ADD, or just even struggling to stay focused at school, to memorize things. It's just hard for them to process things. And just like it is with adults that way, it's the same way with children. And we don't need to miss that. If our child seems to be struggling, it could just be that there is an airway issue. I've also seen kids who are just crazy to deal with. Like they are mean towards other kids when it's not like a family thing. It's not like they were raised that way, but they're mean toward their siblings and just act out or just cry a lot. A lot of times that can be signs of sleep-related breathing issues. And a lot of times that has to do with their tongues are down, they're breathing through their mouths, and their tonsils are swollen or their adenoids are swollen, and you can't see the adenoids unless you have those specifically checked by a specialist. So don't overlook that. That's a big thing for children too. The other thing for children, oh yeah, we talked about that, the crowding of the teeth. If your child's teeth are really crowded when they're young, they probably have an airway. Well, I would almost guarantee they have an airway, but probably have a breathing issue too at night. So keep an eye on that. And we do myofunctional therapy is for children. It's for everybody, really. Okay, so that was lips closed, helps with the breathing, keeps that. We want nasal breathing. That's why, another reason why we want tongue at the roof of the mouth is it's not just to help shape our palate and get our teeth developed and growing the way they're supposed to, but it also keeps the tongue from gathering in our airway. So when we're sleeping at night and our tongue is down, so down here, so it could be up here or it could be down here. So if you look at this area, so this is the base of our tongue that's in the back of our throat. If it's up here, this is stretched and it doesn't bunch up as much when it's up at the roof of our mouth. But when we drop it and it's in the lower part of our mouth, then this can bunch up and it can cause one more obstruction or the obstruction in our airway, which leads to sleep disordered breathing, whether that be obstructive sleep apnea or not quite to that level yet, or something that doesn't show up, but it still is a breathing disorder. So we want to train that tongue to be up, to suction up at the roof of the mouth, to get up out of the airway while we're sleeping. So that's one of the main things for myofunctional therapy. We also strengthen and tone the whole airway in this area, like our epiglottis, the whole opening back behind in our mouth, like where our tonsil area would be, because any strengthening you can do and toning you can do, it keeps that from being lax. And when air pulls in and it's lax, it pulls in too. But if it's a tone muscle, then it's more rigid and it can't pull in as much. So that's what we do in myofunctional therapy too. That's what helps with the sleeping. So then lastly, we'll talk about correct swallow. The reason why we need correct swallow is, well, first of all, that can't always be done unless the tongue is functioning and where it needs to be. One thing that can cause the tongue to be pulled down at the lower part of the mouth and keeping it from coming up is a tongue tie. And so the tongue tie, just think there's naturally an anchor there. So that right there, I used to have a tongue tie, but I had mine released. But that being tight can pull the tongue down. And when it's down, then the mouth drops open pretty much all the time, especially at night, because it's heavy and there's nothing holding your jaw physically closed unless you have mouth tape or you have a chin strap. So the tongue helps suction it up and go up there, but it can't if that tongue is tied. The other thing with the tongue tie is when it's pulled down, and this is an issue I had, whenever we go to swallow, our tongue should be right at the roof of our mouth and it should push there. A lot of people push forward or just anywhere but there. The problem with pushing forward is our tongue is it's very strong and puts tons of pressure, and I could tell you how much number, but I don't have that memorized, against our teeth. So every time we swallow, if our tongue is pushing forward, it is pushing against those teeth. So if you see somebody where their teeth are flared out, or if this is your child or you, and your teeth are flared out, that's likely from your tongue pushing it over the years every time you swallow. And we swallow a lot during the day. Sometimes the jaw, when you have a class 3 occlusion where your bite is underneath, I've seen this too, when they swallow, they're pushing that and potentially could be pushing that jaw too. So when the tongue is pulling down, it can't get up and swallow up the way it needs to, but it pushes forward. Not only does that affect your teeth and how you swallow, but the tongue starts the whole digestive process. So it starts this wave when you swallow, it waves right, and the wave goes all the way down, like all the way down your esophagus and starts all that. Well, when that's not correct, then it can affect your whole digestion and the speed and all those things. And I personally have experienced that because I had the tongue tie, I wasn't swallowing right. I couldn't swallow pills very well. That was very hard. I choked a lot when I drank through straws or drank liquids, and I still do if I don't focus on my proper technique. But so the tongue is supposed to be up and pointing up there. But once we get some things corrected, that's why we end in the myofunctional therapy, we end with swallow, because we've trained the tongue to do what it's supposed to do. We've released it if it needs to be released. And now it's ready to do the swallowing process correctly. And we train that to function then to swallow properly, which then in turn can affect digestion. The other thing it can affect is when our tongues are tight or when we're not swallowing properly and our tongue's all over the place, then all these other muscles are having to compensate for what our tongue should be doing. So I kind of tell people sometimes it's like if you have a point guard on a basketball team and that point guard has its job and he's supposed to move around, do what he needs to do, but he's tied to the floor in that one spot, just anchored to the floor. So all these other guys are having to run around and work harder to do what this guy is supposed to do. And that when our tongue is not doing what it's supposed to do for the correct swallow, other muscles are having to compensate to get the food going to where it's supposed to go and do what it's supposed to do. If you have a tongue tie and you have an incorrect swallow and you get that released, now it's set free. But the problem is it's not going to know what to do unless it's taught to do the proper thing. And that's why we do myofunctional therapy. Now you've got the point guard who's no longer grounded to the floor. Now he's free to move, but he has to learn correctly what his job is and where he goes and things like that. So if our other muscles are having to compensate for what our tongue should be doing, these muscles are doing what they're not supposed to do. They weren't created to help with the swallow and things like that. So when you have muscles that are doing things the wrong way for a long period of time, you start getting pain. And it may not be a long period of time. Sometimes when we clench or grind at night, which has to do with breathing disorders, that just magnifies it all the more. But while we're chewing and swallowing, things like that's a whole different story over there. But it's compensating these muscles, and not just these, but our neck, sometimes our shoulders and things like that. And they're having to work harder and do what they weren't supposed to do. That also happens when we clench and grind at night from sleep disorder breathing, and we're clenching too much. These muscles are going crazy. That's why you wake up with headaches and TMJ issues a lot of times too, which we deal with myofunctional therapy. But you want to swallow correctly, release all these muscles from that pressure, and it provides a great deal of relief from that. So those were the 4 points. You've got the lip sealed, which means you have to breathe through your nose. You've got the nasal breathing. You have the tongue at the roof of the mouth, and you have the proper swallow.